Very briefly about the LDA, we're a national nonprofit. We've been in existence for 23 years. We have stayed volunteer run. We've raised almost $6.5 million for research and education, with 97% of those funds going directly to programs. And Karen mentioned about the Columbia Center. Also, we've been part of the combined federal campaign for the past 10 years, meaning we're approved as a national charity for federal workplace giving. We also partner with the Environmental Protection Agency, PESP program, which basically what we try to do is to control ticks, but try to do it in perhaps more less adverse ways to the environment, as it all, if that's possible. Also, we have more now than 42 partner organizations across the country, of which Lyme Connections is one. And I had the opportunity to twice testify before Congress, the Foreign Relations Committee, the Health Subcommittee there, and also Energy and Commerce, the Health Subcommittee. Basically, these are some of the materials we have. They can be ordered for postage online, many of them, and other ones for very nominal fees. We have a program we're very proud of, Lyme Aid for Kids. To date, we've given out over $250,000 for children whose parents had no insurance coverage for Lyme disease. And we developed this in conjunction with author Amy Tan, and also with the help of our beloved Dr. Charles Ray Jones, I see down in the front. His commitment to children is the same commitment that I think many of us have, and we thank him for that. Also, we worked with Amy Tan, we worked with Meg Cabot, who did the Princess Diaries, and a few other people. We have an education module that can be run directly from our website to be used in the classroom, how a tick can make you sick. There are pre and post tests for that, also for you teachers in the audience. And we collaborated with the University of Medicine and Dentistry, which is now part of Rutgers University, for a video, prevention video for school children called Tickles, and that stands for whatever. Anyway, we've awarded 100 research grants to date to physicians, researchers across the country, various institutions across the country, and also the research we've published has appeared in 35 peer-reviewed journals to date. That's the opening of the Columbia Endowed Research Center, and I'd like to recognize Dr. Brian Fallon over there in the audience, the director of the center. A lot of good works, folks, coming out of there, and a lot of it for the benefit also our children and people with neurologic disease, and we all probably know about that. We also provide medical conferences. We have done 15 to date. Our 16th is upcoming in Providence, Rhode Island. It's jointly sponsored by Columbia University, and we do have researchers from throughout the country and also some overseas who come in and talk about the different tick-borne diseases. So we have a save the date on the website, and we'll be updating that shortly with our speakers. And we also give out education grant awards to organizations and groups across the country. We've given out 105 to date, so that they, in their areas, can produce all kinds of programs and publications and to get the word out, because let's face it, what is it all about? It's all about stopping these terrible diseases. Okay, I mentioned all these. Lyme disease is found now in over 80 countries throughout the world. This is a map that you can find on our website. You can download it, print them out, and if you click on your state when you're on the website, you can see the case numbers from 1990 to 2013 down the side. I did a screenshot. Those were Connecticut numbers over that period of time, 61,783 reported cases, which means that underreported by a factor of 10, so 617,830 cases are what probably occurred in Connecticut, and even that isn't the full extent of it. This is a graph given to me by Chris Newby from Open Eye Productions, and kind of shows you that Lyme generally is going up and up and up. This is a pie graph that can be found on our website if anyone needs it for educating purposes. The arrow shows the slice of the pie that is Connecticut for the number of tick-borne diseases across the country. And this shows the top 15%, and you can see where Connecticut ranks in that pie. And this is the incidence, the number per 100,000. Connecticut has 58.7 cases per 100,000, and that was for 2013. Not doing well, by the way. Okay, these are county statistics. I only bring them up because you can find them. If you search online diligently enough, you can find your county and where it ranks. These are some stats from the CDC that I find very intriguing, and they're kind of at odds with the actions that the government has been taking for tick-borne diseases. And that is in 2009, the CDC said that Lyme incidence was the 7th in the US, higher than HIV, and only sexually transmitted diseases, salmonella, strep, fungal disease, and the flu had higher incidence rates. In 2015, they said it was the 5th most common nationally notifiable disease. Now, you will also hear that people don't die from Lyme disease, and it's been very disturbing to me to see that in the national news recently with discussions of Powassan virus. Well, it's very serious, and I'll mention it, and I think Dr. Horowitz probably will mention it, but people do die of Lyme disease. And here, admittedly, the CDC actually published from 2002 to 2007 that Lyme and Rocky Mountain spotted fever, which, by the way, has always been considered much more serious than Lyme by the government, had reported 36 deaths at that time period. Children, unfortunately, are at the highest risk of acquiring the disease. And so when CDC announced in 2013, 300,000 Lyme cases occurred annually, we did some estimates on the numbers. And what we found is 37% of the reported cases were children 0 to 18, based on the CDC numbers. Now, the highest age group, 5 to 9 and 10 to 14. And then that's Lyme by age group. You can see the highest, and that's the 5 to 9, and the next arrow is the 10 to 14. And folks, this is the one that really gets me. 7% of the reported cases from 2001 to 2010 were the age group 0 to 4. Our babies. The born and unborn are affected by Lyme disease, and this is thanks to Dr. Alan McDonald, because pregnant women can transmit Lyme to the fetus through the placenta, and that is a shot, unfortunately, from a fetal brain. Now, dogs and Lyme. Why do I bring this up? Because dogs can act as sentinels. And oftentimes they are diagnosed with Lyme in an area before people are. And they're 50% more likely to get Lyme than people. And I've often heard as a cat owner, this is sort of disturbing to me, well, cats cannot get Lyme. I'm here to tell you cats can and do get Lyme. My cat got Lyme last year, and I rushed her to the vet because I recognized it right away, and I pulled off 3 ticks that were engorged, and I didn't have any trouble getting my cat treated for Lyme disease, but there are papers out there. Cats can and do get Lyme. So here's the canine prevalence, meaning dogs, and see that arrow? That's Connecticut. So what this means in 2014, 76,000, more than 76,000 dogs were tested by 2 laboratories who report this testing into this Companion Animal Parasite Council. And 16% of those dogs in Connecticut were positive. Now, you guys know probably about most of this. I just want to breeze through these in case there's anybody there that hasn't seen what a fed tick looks like. Next to, that's a straight pin, and that's a deer tick laying eggs. They lay a couple of thousand eggs at a clip. That's the entire, what I call the deer tick family, and that little white clear larva up there, generally speaking, the larvae are born uninfected. They pick up the disease from small mammals. There have been some studies out there that say up to 1%, but there are some researchers that are now saying that isn't true. I'd like to see more research on that. Anyway, this is the deer tick family with poppy seeds, and you can see that they're the same size. This is the American dog tick, which is very important because it is found in this area. It does carry tularemia, Rocky Mountain spotted fever, tick paralysis. And this, folks, is the Lone Star tick. Now, about 30-some years ago when I started, the Lone Star tick was only as far north as where I live at the Jersey Shore. And now that tick is as far north as Maine. And the reason I stress it, it's a very aggressive tick. The deer tick is not aggressive. It hangs along the grass, you brush against it, and it gets on you. This tick will run after you, literally. And so I knew a researcher, actually was a photographer, and his job was photographing ticks. I was like, wow, what a job, right? So anyway, he told me the story of having these Lone Stars in his refrigerator. And he said he took them out and he was going to do the photograph, and as fast, now remind you, they were in a refrigerator, as fast as he took them out and put it on his hand to photograph, he said they just started swarming all over him. Now, I'm not going to tell you what I thought of his job, but I will tell you what I told my husband, who has often brought me home eels in my refrigerator that he uses to, for fish bait. And I said to him, eels I'll tolerate, but if you start bringing me little vials of ticks, it's all over, Buster, you're done. Now, that's the Lone Star tick laying also thousands of eggs, unfortunately. That's the American dog tick, and the deer tick shows you the size in a paper clip. That's in case you want to go out in Phyllis Mervine's country in California and think you're safe. Well, that's the Western black-legged tick. You're not safe. And that's a picture of ticks mating. I told you how they get on. This is really important. I really think this is one of the most important things to me, because oftentimes many of us hear that you can't get Lyme disease unless the tick has been attached for 24 hours, 72 hours, who knows, 3 days. I mean, I've heard all kinds of things, and this has been said over the almost 32 years that I have been involved. Well, to be honest with you, Dr. Willie Bergdorfer in 1999 at the first LDA conference at Bard College, which I almost always thank Sandy Birnbaum, for that experience and leading to 15 other conferences. But Willie Bergdorfer had published, and he said there, this is absolutely not true. He said, the reason that they say they use these numbers oftentimes is because the bacteria are in the midgut of the tick. The midgut is like your stomach, and what happens is it takes time for that to migrate up here into their salivary glands, in their mouth, if you will. And so, but Willie said there are times when the ticks already have that bacteria in their salivary glands. And if they bite you, well, transmission could take place. So what we always say at the LDA, the longer a tick is attached, the greater the risk of infection. And this shows you the mouth parts, the barbed mouth parts of the tick. And what it does is it secretes something to numb you, cuts you open, it sticks a hollow straw-like hypostome in you, and it secretes a glue-like substance on you. Then it sucks your blood, and sometimes it secretes blood thinners and immune modulators. For heaven's sakes, it's messing with your immune system. Not bad enough your doctors have to mess with your immune system, right? But these guys are messing with your immune system. And during feeding, the organisms from the tick flow into you. So please, if you remove ticks, don't put anything on them. Vaseline, gasoline, nail polish remover, don't get them with a lit match. Use pointed tweezers as close to the skin as possible. Pull them straight out. Because if you squeeze them or if you irritate them, they'll inject any of the bad things, and believe me, they have a lot inside them into you. So we have a great graphic from LDA, thanks to Deb Scatuccio down here, for correct tick removal in our Lyme primer. And that, of course, is the familiar bullseye rash. It used to be, before the CDC changed its criteria, that if you were anywhere in the country and you got bitten by a tick and you got a bullseye rash, you could now be considered to have Lyme disease. Unfortunately, that's been changed. If you live now in a non-endemic area, you can get a bullseye rash and you may not get treated. So co-infections, which we've all heard a lot about, I just think it's important for me. I just want to mention them, and I'll tell you why as I go along. But BCA, and I know Dr. Horowitz is going to talk about, that's kind of his baby, and so I'm not going to mention that. Ehrlichia and also anaplasmosis are serious, and in our area of the country, oftentimes, if you get Lyme disease, you can get some of those diseases. Bartonella is something that, even though the CDC still doesn't have it up on its website, most people now and researchers accept that indeed, besides being scratched by a cat or bitten by a flea with this, that it is transmitted by the deer tick, and people get a stretch mark like rashes. Borrelia miyamotoi is a strain similar to Borrelia burgdorferi that causes Lyme disease. And for a long time, it was not recognized in this country as producing disease, yet it was been found for many years in Europe and I think Japan. And finally, they decided over here, like a year or two ago, that, oh, well, maybe this is actually causing disease. And guess what? It's in the same deer tick, and there are some goodly percentages, depending on where you go, not only in the Northeast, but as I found out when I went down Tennessee several years ago, where the health department tried to tell me there was no Lyme disease and no ticks. And I had to go on Fox News with a poster I brought from their own university showing that indeed there were deer ticks all over their counties in Tennessee. And by the way, you also have Borrelia miyamotoi in your ticks. So I always tell people, you wonder why I don't travel back to Tennessee. I don't think they want me there. But anyway, this is what we have to do. This shouldn't be our job, folks. Advocates shouldn't have to be going and doing this. This should be the job of the government and other people that are in positions to make these kinds of statements. Unfortunately, they're waiting for research to catch up to these things. Well, guess what? If you don't pay for research, research is never going to catch up to these ticks. They're fast. These organisms are fast. And this tick is fast, as I mentioned to you, the Lone Star. You guys do have them here, not in as great a numbers as in my area in New Jersey. However, they do produce a Lyme-like disease. It looks like Lyme, acts like Lyme. It produces a rash, or it can, like Lyme, fatigue, headache, fever, muscle pain. There's no commercial test for it, I believe, at this time. It is treated the same as Lyme, and it's very problematic because oftentimes doctors will say, well, no, you have a rash, but you were bitten by a Lone Star tick, you don't have Lyme disease. Well, no, but what about, star eye? Well, they don't even know what organism is causing star eye at this point in time. Rocky Mountain spotted fever, everyone probably knows about. Tularemia, not too much here. There are upper Midwest and a few cases in the Northeast and Massachusetts and places like that. Powassan virus. I really need to mention this because what has happened is this Powassan has historically been here. In fact, this slide, someone gave me this picture. It comes, I think, from 1964 or something out of a journal, and showing Powassan virus. Now, what happened was Powassan virus used to be in other kinds of ticks, like what they call woodchuck ticks and stuff like that, eye ticks. Ixodes marks eye ticks, and it wasn't apparently in deer ticks. Well, guess what? It is now. The cases are increasing. We had a death in New Jersey in 2013 from Powassan, and in Maine there was a death from Powassan. And unfortunately, 2 weeks ago or a week and a half ago, I was in Maine speaking at the seminar there, and the woman who helped organize it, her mom was the one who had died from Powassan. And she got up and spoke about her mom, and then I got up to speak about Powassan, which unfortunately I still had to do, because people have to understand you can get it from the bite of the same tick. Now, there was just a study released here in Connecticut of your ticks that were collected from 2008 to 2012, and they found from Branford and Bridgeport, which I believe were the only two areas they checked, 2 to 3% of the ticks were infected with Powassan. And the unfortunate thing about Powassan and the other tick-borne viruses, there's no treatment for them, folks. You can get some palliative care, but there's really no treatment. And there's a 10% death rate, and if you survive, there's a 50% chance you'll have neurologic difficulties. So it is a problem. You do need to know about it. You probably don't want to. I didn't want to either, but you really do need to. So very quickly, these yellow states showed you this. They have a historical background of Powassan virus. That was the case in Maine. And these were the cases over the years which have begun to rise. Q fever is another disease caused by Lone Star Rocky Mountain wood ticks transmitting the bacterium. And Colorado tick fever, another one. And these two I found out 2 years ago. We redid our Lyme primer pamphlets, and we had only had 7 diseases. We now have, I think, 15 diseases in our pamphlet, and we already, I think, are out of date by about 2. So I found out that there was a Rickettsia species 36D in California and Rickettsia parkeri rickettsiosis in the Gulf Coast, in case you vacation down there. Now, the Heartland virus was found in Missouri in humans in 2009. It's already gone to Tennessee and Oklahoma. The bourbon virus, and no, it doesn't mean that you get a shot and you get better. Basically, it's named after Bourbon County, Kansas. That they've only had 1 case to date, but it is tick-borne. Again, there is no treatment except for symptoms, and unfortunately, this gentleman died. Tick paralysis. This is something a lot of doctors or people don't know about, and it's a toxin in the tick. And basically what happens is the only treatment is you have to find the tick and remove it. If you don't, it starts from your feet in paralysis and moves up, and you could become totally paralyzed. Now, this is something that's happening, and I don't know how many people have heard about it. But I guarantee you it's here. Actually, we're going to have a speaker at our conference in November in Rhode Island on this. And this is a tick bite, a meat allergy from a tick bite of the Lone Star tick that I mentioned. And what happens is the tick saliva triggers an immune response to a carbohydrate, which is called alpha-gal, found in red meat. Now, I had a friend of mine, a good friend, who does a lot of my printing work, called me up, and he said, this is a joke, and I know you're going to tell me it is. He said, there's no such thing that you can get a meat allergy from a tick bite, right? Ha-ha. I go, no, ha-ha, why? Well, his wife, I think, went into anaphylactic shock like 4 times or something before they finally found out. Her allergist had absolutely no idea. A person in town happened to know about it, called her up and told her, and they called me because they were sure I would say no way. So it's happening, folks, and we're going to have a doctor who has 200 cases already in the region at our conference. I just want to, just briefly, I don't know, how am I doing on time? Your watch stopped. Okay. We currently have 2 bills in Congress, 665 and 789, both in the House by Congressman Smith and Congressman Gibson, that would establish advisory committees that would have patients and treating physicians at the table, something which we pushed very hard for, and we worked with Mr. Gibson last year to get that passed through the House. Unfortunately, there was no Senate component of that. We've had a number of meetings with federal officials in Washington. Twice I've been invited to the CDC in Fort Collins in 2007 and also in 2013. In 2013, I was joined by a number of our fellow advocates, and we presented there to the CDC the problems that we saw as advocates. And my presentation was basically debunking why they say they claim that that Lyme disease is not a nationwide disease, but they don't have anything to back it up. So they sent me a slew of material, and when I went, I did a slideshow, and I said, well, this book here was published literally in the year that I was born in. I have some issues with this material. But anyway, the important point being is, folks, that with travel being the way it is, the amount of diseases, that's why I wanted to go through these tick-borne diseases. Well, why is she telling us about Kansas and Missouri and California and all this? Well, because guess what? Those diseases are there yesterday, and today, unfortunately, they're going to be here. And you know what? It's our doctors, our ILADS physicians, and others like them who have been working in the trenches for so many years. Witness Dr. Horowitz over here, Dr. Fallon on a different level with research, that these people have come up with ideas and found things that are not acknowledged until years down the road. And there's something wrong with that, folks. There's something terribly wrong. In the meantime, what I see is children, many children, and who are just getting sick with this disease. And I started with 3 daughters, 2 of them who became Lyme patients, and I now have 4 granddaughters. And I pray every day that none of them will become afflicted with Lyme disease. And so right now in Washington, what are they doing? Well, in their infinite wisdom, the FDA has decided that they want to take over Lyme disease testing. Not just Lyme disease testing, but any tests that are called specialty tests. What are specialty tests? Well, if you have a specialty lab, not like your LabCorp or your, those major labs, but you have labs that basically, they develop their own testing, and they have to go through a rigorous process called a CLIA approval on those tests, and the FDA now wants to take them over. So fortunately, we have great partners across the country, and I've been working with Phyllis Mervine, Lorraine Johnson from LymeDisease.org, and a couple of other people, Betty Maloney from Minnesota, Ray Stricker from California, and we've been working on this very issue. We presented to the FDA on the phone. The LDA sent someone down to Washington to present, but if they take over these tests, it's going to be very, very problematic because we don't know what's going to happen. They're going to set up expert panels to review these tests, and those of you who have been around a long time know who the experts are. Anyway, also the IDSA guidelines in 2015, they are up for redoing, and they just had a period where you could have public comment. And again, we worked with our friend in California, LymeDisease.org, and we've been getting groups across the country. We've sent letters that are well-reasoned letters about why the process should be fair. They should allow patient representation on the panel, and they should allow treating physicians on the panel. But I don't know, folks. We've done a lot. We'll see what happens as a result of that. Also, and I'm almost done because I know I don't want to take up too much time here, but doxycycline shortage. For a couple of years, there was a shortage of doxycycline, though the FDA apparently told Senator Schumer there wasn't really a shortage. So I don't know what the patients and doctors were complaining about, but anyway, Senator Schumer asked me last year to a press conference, and Jill Auerbach and I were somewhere in this room, went up to that conference. And he talked about, this issue and how concerning it was. So what's happened is you can get doxycycline now, but the costs are astronomically inflated, where it used to cost something like $25 for a prescription. Now it costs, I'm hearing from patients, $300 for the same prescription. It's outrageous. There's no vaccine currently for humans. I think everyone probably knows what happened to Lymerix. It was withdrawn from the market, cited as lack of sales, but we all know there was a backstory to that. Basically, vaccines now in Europe in the trials, there's a phase 3 Baxter trial. They're still using the OspA, which was the base of the other vaccine, but they said that they have taken the little piece of the OspA that was causing the problem problem, and they have supposedly neutralized it. Well, that remains to be seen, right? So how much money is our illustrious great government expending on tick-borne diseases? Well, not much. This is probably egg money. For 2014, the NIH, $23 million, and the CDC, just under $9 million. This is disgraceful for a disease that's causing 300,000 cases at least every year. Now, I found this interesting study, the U.S. Army Public Health Command, and I thought, oh, won't this be great when I figure out what it means? And then I read that a total of 1,313 incident cases of Lyme disease were identified from 2,218,559 person-years of active component U.S. military follow-up. And I read that and I was like, what? So I sent it to somebody in Washington who reads these studies, and I go, read this study and tell me what it means. And he wrote me back and said, well, I got to that 2 million number, and I said, you know what? This is ridiculous. So basically, I don't know what the number means, but I think that it's interesting to show that the military, and we've met with them a number of times in DC, and also I've been down to Aberdeen Proving Grounds to meet with them. These are the clusters. The big blue arrow in the corner, that's Connecticut Cluster J, and that is Naval Submarine Base New London, and that's the cluster of where the military treats their Lyme disease in that region. And Cluster D, which is down a little below that, unfortunately, the big red dot actually is right on top of my house, which was very exciting to me. So this was the interesting part that I found, and useful part, because I haven't figured out the rest of it yet. I'll let you know when I do. But that they showed the types of ticks that were submitted at each location from the military. These were what they have a program in the military where they collect ticks from military members, can send them in. And so the green ticks, believe it or not, are that Lone Star tick that I mentioned to you. And the red ticks are the deer ticks, and the blue lines, that's the American dog tick. And you'll see here again the blue arrow, the small amount of the Lone Star tick here, but if you go down 2 lines, that would be me. 71% were the Lone Star ticks, and again, remember they've just been moving up here in the last, let's say, 15 or 20 years. I guess it takes a little while to walk from New Jersey up here, but what I'm saying is all the diseases that are inherent in these ticks are coming to New England, and some of them are here, and you do have some of them already. You do have Lone Star ticks, just not in great numbers. These are the clusters of ticks, showing you the pink ones are the deer and blah, blah, blah. So anyway, little interesting. Past legislation that was mentioned early on. Recent state legislation, there's been New York. The New Hampshire bill just, by the way, passed. It is expected to be signed by the governor within the next week, and it will require the state of New Hampshire to link to the ILADS website, which is quite a coup. The Maine legislation is still being worked upon. Oregon legislation is, and they just also got Lyme disease awareness. You've heard about the Connecticut legislation. LDA sent in testimony for all of those and helped with some of the development. The last comment I just want to make, because people are often anxious to rush for legislation. Legislation should be a last resort. Before you ask your legislators, wherever you live, to do anything, please understand that they need to understand what the issue is, and they need to understand the opponents that they're going to go up against, because there is a lot of them. The bills are often commandeered. You have to understand every word in the bill, where it's placed in the bill. You need to educate everyone in the legislature. When I came up here, as Karen pointed out, work with Maggie Shaw and these guys on the Connecticut bill, people thought I lived here. Truthfully, they'd say, well, why are you driving to New Jersey tonight? Well, I live there. Well, I thought you lived here. I go, no, this is my second home right now. So anyway, I just want to say that you have to be cautious, that's all. Legislation should be something, again, you do as a last resort. It can be useful, but just remember this and think about it. When was the last time in your lifetime that you remember legislation being repealed? So thank you very much, and I'd like to thank everybody connected to this.